Yeah, I think us and even sometimes personal trainers can serve as a great liaison for people who just maybe haven't been exercising as much as they have and changing their lifestyle. And a lot of the time, like even like during like post COVID, I don't know if you saw this in your clinic as well, but like a lot of people just were getting injured because they haven't been working out in how God knows how long, and they just stopped working out because of COVID and they had to take care of their kids or, you know, they just wanted to stay in the house because the gyms weren't open or whatever. And so it was kind of weird to see that, this whole entire time during COVID, one of the things that wasn't promoted was like continue, like stay healthy, get active, and be better because this is affecting people who are generally have a lot of comorbidities. And I think again, we need to be very big advocates into changing the way people look at exercise and their health habits.
Yeah, absolutely. I think this, year of the pandemic and these past few months have really shown people um, what it means to take care of their health. I hope there is a bigger push to eat better, exercise more, take your vitamins, just take that holistic approach to preventing yourself from being locked up and staying inside and just like everybody's kind of been experiencing this year. It's been rough on everybody, right? And so we know exercise helps release endorphins and makes you feel better. And if you're just cooped up, on your Zoom meetings for 8 hours a day in your house, it's not only going to affect your body, but it's going to affect your brain. And we're starting to see a lot of that as things open back up and people, becoming more active, which is amazing to see. But a lot of people, like you said, just saying, I sat inside the past year. I worked at home. I didn't have to even walk to my car and drive to the office anymore. I was doing, 5,000 less steps a day for the past 12 months. And, now I'm trying to get back into running and my knee hurts. So there's a lot that goes into that for sure. And uh, I think it's been a fun experience and challenging experience as a PT to help with not only the physical changes that have happened in the past year, but the mental changes that go along with that.
Yeah, and how have you adapted mentally and physically? I mean, being a clinic director now is fantastic, but how have you changed maybe in your treatment style and what you're doing with your patients? Like, are you focusing a lot more on education? Are you really honing in on your skills with manual? Like, what's been changing?
With my treatments, not much has really changed in the clinic. One of the bigger changes we had as a profession and as a company is treating post-COVID patients and trying to learn what some of the impairments were for people that had to go on a ventilator or just had the long haul COVID symptoms and used to be able to run 4 or 5 miles a day, but now when they walk a mile, their O2 sats drop to 90%. And I think those changes as a physical therapist has been challenging just because we don't have the research out right now to support it. So you kind of just go off your best judgment and your physiological expertise. When it comes to personal lifestyle changes, haven't been to a gym in about a year. Kind of been doing the whole garage gym for myself and trying to keep my mental health sane that way by working out when I can. Uh, and for I guess PT, at first everyone was a little hesitant on getting back to manual therapy and having that contact with the patient. Should we put gloves on? We're definitely wearing masks. Are we gowning up to have that close to contact? But we followed the CDC guidelines, kept masks on, kept hygiene. Tried to limit how many patients were in the clinic at one time, which I was fortunate being in a one PT clinic. It wasn't super busy. So spacing out where I can, and I don't think my treatments really changed per se with COVID.